Welcome to the Critical Therapy Antidote podcast.
Leslie, welcome to the CTA podcast. It's so good to have you with us again.
Thank you. It's great to see you as always.
We've had some really interesting talks over the last, it's been a little over 2 years or 2.5 years since we first met.
Yeah. Yep. Since about November of 2022.
November of 2022. That seems like ages ago, and yet it feels like the time has just gone so quickly. I don't know how, but it's just whizzed on by.
Yeah.
So we have kind of an interesting connection, and I guess we'll start with that. And I'm sure a lot of people that, are listeners with both of the podcasts that we have heard a bit about our history, but I think it's really important to kind of just recollect for a moment what things were like when we first spoke out. We have a unique bond, I think, and connection because of the fact that we both have a relationship with the schools that we spoke out against, and that connected us almost instantly. What do you remember about when we first met? Do you remember what that first conversation was like? I actually don't. So I'm actually wondering if you do.
I'm trying to remember who it was that connected us. I think it might have been Carol Sherwood.
Yes, it was Carol.
Is that right?
CTA.
It was
that
Carol.
Is right.
Okay.
Yeah.
Yeah, I had I put out a video on October 19th. That was when I started my YouTube channel, and I posted this little 8-minute video talking about my concerns about counselor education and my experiences in my program. And it probably was just a couple weeks later that I got an email from Carol telling me about you and that you had been a professor there and asking if I wanted to connect with you. And so, of course, I said yes. And then you did an interview with Benjamin Boyce, and I watched that. And then he had invited me to have an interview with him as well. So that's how I met him. And we're married now. So I guess a lot of things happen in
Yeah.
little time sometimes. But prior to my interview with him, I had watched yours, and I was listening to your story, and it was just really, I really appreciated the broadness of your perspective, I suppose. I mean, you gave a lot of your own background, and I could relate a lot. I think we're about the same age, and culturally we've had a lot of the same sort of American experiences with concepts of race, and this was the thing that was being really pushed very heavily in my program anyway, was that I was objecting to. There was the gender stuff, but there was also this really heavy emphasis on looking at race in this particular way. And I appreciated your American experience, and then also your particular ethnic experience with regard to interracial relationships and the paradigm of what it means to be in a multicultural society versus what you were suddenly being asked to teach and speak to in that program. So I could relate to the jarring change that you were describing.
Yeah. I remember going on Benjamin's podcast also. I think it was one of the first ones I did. And he had kind of approached, and it was interesting because he did ask a lot about just my history growing up in this country. And he gave so much rich context, allowed me to share that context of my perspective and where it came from, how it was shaped. It wasn't just because I was a professor at Antioch or that I had gone to Antioch, although both things are true. But there was this other context and part of my history that he was really interested in, which I really appreciated. So yeah, and I remember I was really excited. I felt that it was just very, and I think this word, maybe, I don't know if you feel this way, but for me, I've heard the word brave and courageous used so many times to describe speaking out against, and I don't know that it's speaking out against from my experience as much as it's exposure to what's happening. And here's a look behind the curtain, and this is not acceptable, and this is not okay. I appreciated so much from the student perspective, because I think that what was happening in your program was even a couple of steps further down the line of this woke ideology kind of rabbit hole than even the LA campus at the time.
Wow.
Because they were specifically telling you, right, that they wanted the counselors to not treat Trump supporters. I mean, that's always going to kind of stick in my mind, right? That even wasn't as explicit with us. There was this, implicit kind of understanding that, this administration has sown so many, seeds of hate and racism, and we're so happy that the Biden administration has come into play. But I don't know that we ever directly said to anybody, we want to train therapists so that they do not treat Trump supporters. The issue was really that the students themselves were saying it first.
Mm-hmm.
So your experience is that maybe you can share just a bit about what those moments were like for you when you first discovered that, kind of what you were thinking and feeling just in the moment, them being so blatantly open about that without batting an eyelash whatsoever.
Gosh, it was, I think of it like it's a lot of different competing temperamental and circumstantial characteristics and qualities, I suppose, that make a person take the action that they take. I've used this example before, that when, and I know this is off topic, but it's, I think, a fitting metaphor really is, during COVID, I had a hard time with the masks, and I wouldn't wear them because I thought that they were, and this is probably going to upset some people, so I'm sorry, but I didn't believe that this was helpful. I thought that this was superstitious. And so when I would gear myself up to go into a store, knowing that I would probably be the only person in there not wearing a mask, and that I would probably be at least disliked, at the very least, and at most accosted or yelled at or even kicked out of the store, there was this question like, do I just cave in order to go along and get along, or do I stand on principle and say that I won't participate in something I think is a harmful lie? And it wasn't like it was easy. It was a hard choice, because I really wanted people to like me, and I really don't want to be threatening to people. And I know other people who had those same mix of feelings that I had, like they really resented the mandate, but they didn't want to upset people either. And the tipping point was just on the other side. The tipping point was a little bit further to, I really need to be perceived as a nice person. And
Yes.
so and so for me, I guess I have enough of that. I'm either not quite as agreeable, or I am a little bit more defiant in my own way. It's just a combination of things. And I got to the point where I felt like it was really important for not only for me to say this is not okay to the school in a big way, but also to, like you said, pull the curtain back and say, look, this is so bad that consumers need to be aware of how bad this is. So the Trump supporter thing, yeah, that was really shocking, because it was there was a culture in the program of talking about Trump supporters. That was the first place I'd really heard that phrase over and over, kind of being used to characterize an entire swath of people. And I'm still not exactly sure what is being described when we say Trump supporter, because I do know people that I could call Trump supporters because they have like a Trump bumper sticker or a MAGA hat or something like that. Like, I'd call that a Trump supporter. I also knew people when Obama got elected that put an Obama sticker on their car. I was one of them. I even went to his inauguration. I went from Texas to DC to be there so I was an Obama supporter.
Yeah.
But I also knew a lot of people who voted for Obama that I wouldn't have called Obama supporters. I would have called Democrats who voted party line. And I also know people who voted for Trump who are Republicans and who just would always vote for the Republican candidate. And then there's that middle ground where you have the independents that switch from side to side depending on how they see the policies in that given election cycle. So we started to use this pejorative term, the Trump supporter, when I was in this program. And it seemed to mean, and it was sort of like in the culture, it meant someone who was bigoted, stupid, and basically beyond help, beyond any attempt to reach out to them. And the place where you're kind of quoting one of my faculty advisors when you talk about not being able to work with the Trump supporter, and I've said this many times on my YouTube channel as well as in other interviews and conversations, because I think that it really should be shocking to people that this is happening in the mental health education field. My faculty advisor told me, we know that we are no longer training counselors who can work with the Trump supporter. Mm-hmm. She was acknowledging that in this school, which trains a really large number of counselors entering the mental health field and entering the workforce, the faculty and administration are aware and endorsing the idea that their graduates will be unable to help people who vote for Trump or are Republican. Mm-hmm. And as you know, counseling is, and we could talk about this as a side tangent, but the increasing medicalization of mental health.
Yes.
There is this is part of your medical field now. And if we can cut off support for people based on wrongthink,
right,
to a medical necessity, a service that they, as far as our medical model says that they need, what other things could we cut off services from? And it's really quite a terrifying thing. This isn't something that I took lightly. This was something that I was really appalled by. That was a part of the process. That was a part of my decision-making process when I was thinking, well, I need to talk about this. But at the time, I just didn't, I didn't have any kind of platform. I didn't think that anybody would necessarily listen, but I felt like it was incumbent on me to try.
Yeah. And I mean, I think, what was interesting for me is I started teaching at Antioch in 2016, and that was when Trump was elected the first time. And what took me aback was the fact that I had heard that students were being excused or allowed to be excused from class in order to go to protest the, election. And that immediately struck something in me that was like, I don't know that this is right. But at the time, I think I was still so immersed in the very, radical progressive. I was impacted by that. I knew something didn't feel right, but it was everywhere at the school. And, I trusted Antioch because I was a student there. So I went back as my alma mater to work there. And I had really appreciated the education 20 years ago, though. And it was no longer the same. But, I kind of knew something was a little bit off about that. But at the same time, I think to some extent, I may have grasped on to the progressive side maybe a little bit more than I realized, because it wasn't really until I was away from teaching and working for a little while, because I had had a medical procedure. I had some work done on my neck. I'd had some surgery on my spine. And that actually was when I stepped away and said, oh my gosh, and I could put all of these pieces together now where, okay, they're letting people leave class to go protest the fact that Trump won in 2016. There's signs all over the psychology offices where, when I first started, I was adjunct, right? So I didn't have an office. I became full-time. That was a huge honor, because to have only a master's degree and still be allowed to be a full-time professor it was unheard of. It just doesn't happen often. But they're a private school, so they can do those things. And, it just spoke a lot to what the students thought about being in my courses and how I was doing there. So of course that was a really big part of my identity at that time. But I do remember when I was hired full-time that I did get an office, and that's when I started going up to the psychology department. And that's when I started to see the signs, like the literal signs that are posted, that started to bother me. There were rainbow flags everywhere. And then there were the, intolerance will not be tolerated. And I always have to kind of put my fist up. And I do that when I say that, because those posters had fists up. They were a poster that had that picture. So you immediately walk in to the psychology department, and right away there's this feeling of tension and anxiety that came over me that doesn't feel right. And I'm sitting here thinking this is not feeling comfortable, but I'm not affected by what these people are saying or doing. I'm just here teaching my classes in this vacuum. So, and I had advisees too. And my advisees would come to me initially about, all sorts of different, I need to graduate on time. I'm missing units. I'm this and that. But at some point during this particular time period of 2016 to 2020, they were starting to come to me for something else. They were starting to report back to me what was happening in their classes. They were starting to tell me that professors were saying things like your advisor said to you. They were starting to tell me, and then I started to get white men that were coming to me and saying, "Okay, Christine," I went by my first name. I was never really pretentious about that stuff. But they would address me that way, and they would say, "I can't talk in class. Every time I try to say something, I either need to use the caveat of, I know I'm a white man and I know I have white privilege. So let me put that out there first before I respond and for the rest of what I want to say." Right. I mean, it was absolutely, horrifying to me. And I'm thinking, why do you have to excuse? I mean, you have to apologize for being a white male before you're able to say something. And that was the students that felt like they could talk. There were some that felt like they couldn't say anything at all ever. And so I became also a little bit distressed by this. And I found myself telling them, I don't think you're going to be able to change what these professors think. It's starting to become more and more, prevalent here. And I started to become really open and honest with them about what I was seeing. And I told them, I don't know how you're going to continue through this program if this is how you're feeling now, taking a couple of these classes. And there was a part of me that felt somewhat like, am I stepping the line here by saying that? But I felt the need at this point to expose also. And I felt that I needed to be honest, and I felt that I needed to validate that what was happening was wrong. So I think those were the beginnings of something happening within me that was stirring and saying, okay, the school, it's not just me, and it's not just, a small portion of classes. It's not just the community psychology classes. Now we're talking about the classes that are actually just supposed to be teaching theory and personality theory, classes that should have nothing to do with that. They were just supposed to be teaching those practices. And so I started to then feel as though something here was really wrong and we were going to have a major problem. I don't know how I coped with it actually at the time. And I don't know if maybe you have some feelings about that for yourself, because I want to hear your thoughts about that. But coping with it for me, I found one professor friend who I've never talked about before in this whole time that we've done these, who I don't want to give up too much about her to protect her, but she was one person I confided in who felt the same way. My coping strategy at that time was I would just go talk to her and I would just say, what are you doing in your class about this? What should I do? What is going on with the other classes? Are the students coming to you and saying the same thing? And we would sit there and commiserate. And I mean, we would talk for hours per week about what to do. And that was my coping strategy. That's kind of how I made it through the amount of years I did. I loved teaching. That component was really easy for me. But what these students were reporting and what I witnessed in the department and what I was starting to get via email about what they wanted us to start bringing into the classroom, I really didn't know what else to do other than talk to this friend. And the timing, I guess, happened to be serendipitous, because around the time when it escalated, I had to take a step back and have this neck surgery and cut myself off from working altogether in order to heal. That's the time in which my journey of coming out and exposure, I guess, really started. So I'm curious in terms of, I mean, were you in a position where you felt like, I'm going to have to find a way to cope if I'm going to get through this, before you decided that you were going to expose and leave? How were you coping with your classes on just kind of this regular basis? Did you have people that you were actually talking to about this stuff? Or did you feel so isolated on this island that you really couldn't, especially being a white woman, being white?
Yeah, it's a really good question. And quickly before that, I just want to acknowledge a couple of things that you said. It's the tension in the psych department. When you describe that, those those
Yeah.
posters and stuff. And then you talked about
Yeah.
how coming into the psych department filled you with tension. How
Yes.
backwards is that? I mean, how
Yes.
backwards? You're going into this place where people are supposed to be enjoying the study of human behavior and the work of helping other people.
Yes.
And yet you get filled with this tension. And it speaks to that deep conflict between, counseling as a positive, resilience-based movement and the social justice movement, which is
Yes.
a resentment-based movement. So
Yes.
that's fascinating. And then you also talked about the students that would come and see you, the white
Yes.
men that would come and talk about their experience. And I just thought about this as you were saying that when I was in my second quarter of this program, when they
Yes.
really started the social justice education, this girl that I really liked, she was like my favorite friend I'd met in the first little period of time that I'd been there, a couple months, was starting to get to know and like. She suddenly started talking about cishet white men. And I remember hearing that phrase and I'm like, what are you saying? Like I had to slow her down. Like, what is the word that you're saying? I don't understand it. And it was cishet white men. And it was this like big, like this new group she had learned to dislike. And I felt like I was watching people get radicalized. It was weird. And then the other thing just that I'd be curious to hear more of your experience with, I'll answer your question first.
Sure.
Before totally derailing us, but I can't help but pick up on one aspect of what it sounds like is a prevalent part of your experience. And I've talked with other professors that have experienced this too. And that's the pressure from the students.
Yes.
To push this stuff. So it's not just top down, it's also
That's
bottom up. And that phenomenon is really fascinating to me. So it's almost like they're demanding that you teach them in this particular way.
That's right.
And there's dual pressures from administration and the student body to clamp down ideologically. And I find that really kind of just fascinating and scary also.
It was, because there are periods of time where I would say that the pressure from the student superseded the pressure from what was happening at the top. Because at the top, you had times too where, they would get very busy with different things and, people were kind of all over the map. We had different comings and goings and we'd get these emails. I'd hear conversations, as you said, the tension in a place that's supposed to bring a sense of healing and comfort that brought me instead tension, anxiety. So those things were going on. But I wasn't directly talking to a lot of these professors necessarily or having long conversations. I remember being asked to teach a human sexuality class and I said no, because the person who was teaching it at the time, who was a trans male, told me that when he discussed heterosexual male sexuality in class, he got in serious trouble from the students in their evaluations, and that went to the head of the department.
Oh my gosh.
You weren't allowed to talk about
male sexuality
if they're hetero. Correct. So my answer about teaching a human sexuality class was a big, gigantic no. I said I'm not touching it with the people.
It sounds like it's a landmine.
Yeah, and it really was a landmine. So, there were those moments, but the pressure from the students at one point was more severe in that in class, I was starting to notice that case studies I would bring in or examples I was bringing in, that these students were wanting me to add marginalize, I'm putting that in quotation, marginalize and disenfranchise aspects to the people that were in the case study.
Oh, wow.
That's what they wanted. So
the students wanted that.
The students wanted it. So I couldn't just have kind of your average middle class American family, for whatever that means, and this is what's happening, and let's break this case apart and kind of look at its pieces and how would we treat the couple, how would we treat the individual, whatever, the dynamic was. I had to start bringing in cases that had a lot more complexity with regards to the disenfranchised groups. So I needed to bring in people that I specifically said, the Black, woman who is, non-binary. I didn't know what that even meant at the time. I don't know if that's an embarrassment, if I should be embarrassed or if I should just feel normal that I didn't know, but I didn't. So when they were starting to say, well, Christine, what about the non-binary people? I went, oh my gosh. So I've got to create now. I've got to add now all of these different aspects. So like the non-binary Black woman is supposed to be one of the most disenfranchised, groups because of she encompasses or them, they encompass, according to those pronouns, all of those aspects apparently. And if that wasn't in the case studies, the students would cause, a bit of a ruckus and would say, well, what about them? So then we would have to I'd have to start incorporating that into the case studies. Otherwise, we were having these conversations in class anyway. And it was kind of taking up time from some of the other subjects we needed to cover, which were about, trauma and about traumatic grief and loss and addiction and treatment of addiction and all of these things that were very important, and process one classes. How do you sit and be in relationship with a client? Like, how do you just sit in a room and hold space? And what's that like?
It's almost like they want you as the professor to cobble together some Frankenstein monster of the most marginalized demographic categories that you possibly can, and then act as if that's going to be your client. And I feel like one of my major complaints with the way that this is being taught is that critical social justice theory is basically applied demography. It's a social studies project. It's social psychology at best. And it's like a really watered down and ideologically driven version of sociology or social psychology. It has nothing to do with individual psychology, and creating this perfect concept of the marginalized victim client based on your matrix of demographic choices is really strange. I mean, it seems like a response to those students would be, this isn't a program for you if that's what you insist on doing.
It's funny you say that, because I actually said that to several of my classes.
Really?
That if you can't handle treating a client that's white and that is an upper class, let's say an affluent person. Okay, let's just use that as an example. If you can't treat a white affluent person, then you have no business being in this field, and you need to pack up and leave right now. I would say quite a few controversial things in classes, because in one way, yes, I don't know if bullied is a good word, but I was forced, into accommodation to an extent. And then there was this other piece of me that said, no. I mean, I had a lot of my own internal battles over this. And so there were times where I would just say, you know what, if that's what you think this is going to be about, and that's what you're looking for, then you need to leave this classroom right now. That's not psychotherapy. What you're talking about, these political conversations you're bringing into the classroom, that's not what we do in psychotherapy. Go be a poli-sci major, and there are other places and other schools that'll accommodate that, but not in my classroom. And I would literally speak to them that directly. This is, I think, why I was never complained about directly. Nobody ever complained and said, Christine isn't covering enough stuff about marginalized people. But it was being told to me in other ways, verbally in the classroom, sometimes in the evaluation, but nobody actually went above my head. I left before that could happen. I left right at the cusp when I knew that the very next time I do this.
Yeah, the writing was on the wall.
The writing was on the wall. And the head of the department said, the professors I love the most are the ones that are not talked about, that students do not come and talk to me about, because they only talk to me when they're complaining, not when they're praising. So that stuck with me. And I said, okay, that's what I'm not going to be one that's complained about, but also I can't continue this lie.
Yeah.
Because I was also lying. So, so the lying component, because I was also starting to say things like, well, we know that there's systemic racism. And I'm going, what? This is coming out of my mouth. I don't agree with it. And where is it coming from? This is very bizarre. I started realizing that I was getting pulled into this kind of mess. And it wasn't until I stepped away in 2020, 2021 for a period of time that I thought, I don't know if I can go back to teaching. And I've shared this story many times, that there was this new model of addiction, that addiction treatment I was teaching, that came from West Virginia. They're using these amazing, interventions that are getting more people who overdose to decide to go into treatment after they're stable, and less people who are overdosing and dying. So they're having some amazing statistical responses to this, and it's a holistic way of treating addiction. Not just the medical model. There was a lot of incorporating of other psychosocial factors and different components that were made it such a dynamic way to treat the issue. But because the person who presented this model was a white woman, and this was in West Virginia, which is 90-something% white, there was a lot of pushback from the students about learning this model. That was horrifying to me as well. I mean, because if I'm sitting there thinking about, and I'm telling them we would adapt this model to different communities. You don't just use the exact thing, you adapt it to the community that you're working in. But these are the components of this model that are making it so effective. I need all of you to be listening to that, not the person, delivering it being white or it being about a state that's mostly white people. That's not the point here. That's not why I chose, to bring this TED Talk in and for us to actually dissect this and look at it together.
Right. Well, it's really horrifying to hear that you got that kind of response, because that seems, I don't know if I'm being dramatic when I say it seems pre-genocidal. It's just a terrifying thing to teach people to deliberately try to reduce empathy towards certain groups of people. Like, these are the kinds of ways that we were talking about white people in the program that I was in were it was horrible. I mean, white women were Becky's and basic bitches and nothing special, and their tears were overvalued. These are words that came out of my professor's mouth about white women. And, you've got the cishet white man, and he's just like the lowest rung on any totem pole. And my multicultural perspectives course was just video after video of how stupid white people are, about people making comedy spoofs of white people being stupid and setting you up to fail if you compare these examples of using your privilege and being a white savior, one of which is good and one of which is bad, but we're going to show you identical examples so that you don't know what the right way to behave is if you're a white person. And for this to be taking place in a counseling program of all places, this is applied human psychology, is it's really stunning. And when you asked earlier about coping mechanisms, what did I do to cope with this while I was in this program? The first couple of quarters, it was just really hard. I didn't have much of a support network for this. I was working part-time, and I was watching my workplace go a little bit woke. I mean, I worked at this naturopathic clinic that I'd been at for about 6 years, and it had been a lovely little place, but our lactation program was they were debating things like chest feeding, changing the name to chest feeding. And I think they settled on baby feeding. They were looking for but they were actively trying to remove anything about mother or breast, from this word. At the same time as they were also trying to remove lactation, because you didn't want to offend people who couldn't lactate, who had some kind of issue and needed to bottle feed. So it was just going to be baby feeding. So you're watching these kind of movements to flatten things out and avoid offending sensitive groups while not caring at all that you are sort of erasing the existence of the majority of people in the process, and the human side of this. So that was going on in my professional life outside of the school. I was in my early 40s and did not have some kind of cohort that I was going to school with. It was very mixed age, and I didn't know anybody there except for the girl a couple of people I was starting to get to know. And my favorite one was the girl who suddenly was up in arms about cishet white men. And so it was kind of an alienating and lonely experience to be there. And I was in by second quarter in this struggle session with my professor who was trying to talk to me about my white privilege every time I tried to criticize some or challenge any of the teachings that we were being taught, which were just really sophomoric and reductive. And I was really struggling. I was really, really struggling. I was very depressed. I remember that when I started this program, I left law school several years before, midway through my program. It's a 3-year program, and I left in the middle of my second year because I had decided I definitely don't want to become a lawyer. After seeing this much of it and talking with people, and I was working with this attorney who was my I wasn't her intern, but she was my mentor, I suppose. And I'm getting this better view of the law field and looking at what I was going to be getting into and realizing I made a mistake. I should have gone into study in psychology, because that was the fork in the road for me when I went to law school. It was to go into academic, more, go to a PhD program or a counseling program or go into law. So I left law school thinking, no, I'm going to go into a counseling program. And then I had my 2 sons, took some time off from school. And now I'm finally back, and I've put so much into this. Like, I've put so many years hope and ready to finally build a career. And I am being blocked by this thing. And I feel like I'm just going to end up, if I pull out of this, I've already sunk a lot of money into it. And I've worked really hard to align my life so that I can be here as a graduate student. Mm-hmm. And if I have to go back to the drawing board again, I just don't know if I have another go back to the drawing board in me. I've already done that, and that's why I'm here. And so it felt like it was a real personal crisis to confront this and realize that if I wanted to go through this, to get this career that I'd been aiming at, I was going to have to go through a dark night of the soul. And I wasn't prepared for that. So to answer your question in the beginning, I didn't have great coping resources, but I developed them as I went on. Critical therapy antidote was massive for me. It was like finding Val and reading her article. I know I sound like I'm doing an ad now for CTA.
We'll take it.
Yeah. But no, it was like such a lifeline. I read Val's article in New Discourses, and I immediately wrote to her. I was like, oh my God, you're speaking this, you're speaking about this thing that I haven't been able to find anybody articulating, and I'm going through. And so I quickly started to engage with CTA. I was there like pretty early on, and having these meetings with people, and Jennifer Friend and Erin Kinsfodder that are still really good friends of mine and good, important colleagues. So just finding this network was the beginning of a new, of me being able to actually access those coping resources, those things to help me manage.
Yeah, that like CTA for me was that as well. It's interesting because actually when I took the time off to recover from my surgery, I found FAIR at that time, and I found CTA right after I found FAIR. So what made it easier for me to leave, to decide to resign and leave teaching, I had no intention of making a video or doing anything that was public. What happened is that when I started working when I saw FAIR, I went to them and they had this opportunity for me to work in their diversity department and, do some different kinds of teachings and things. And, I was totally enamored by that. It seemed like the really good fit. I liked what their philosophy was at the time. So that made it easier for me to say, okay, I'm going to resign from my job. It was FAIR who said, would you be willing to make a video? If you make a video, just know it's going to go on our site. It's going to be public, and a lot of people are going to see it. And there could be backlash. Are you prepared for that? And I said, well, and before I could even answer, they said, but we have a legal team here. And if you do get backlash, we'll represent you. And I said, oh, I'm so down for this. Immediately sign me up. And that's why I actually ended up being public and making a video. And I don't think I've shared that before either. It's interesting because as many times as you tell your story, and I would imagine you feel this way, just different details again start popping up that you remember. And so that was the reason that I ended up making the video that I made. It was because they had told me we'll support you. So I did it. And they said, do you feel you want to be, they kind of coached me a bit. Do you want to be honest with your, organization that you're leaving about why, or do you, or not? And I said, no, I'm going to be honest. I have no problem with that. If I'm going to if I'm going to make a video, then I sure as heck am going to be honest about why I'm going. So that was actually the springboard. And I was very comfortable because I already had another place to land. I didn't know where I was going to go with FAIR in particular, but for a very short period of time, that was my landing zone. So I did feel comfortable with that decision. It actually took me being at FAIR for a little while and then needing to leave altogether for other kinds of reasons, health, family illness, and then I had other health problems that showed up. That's when the grieving aspect, or the part of me that really felt a sense of deep loss, that's when that got really activated. It was after I left FAIR. And so it's because FAIR was that soft landing, I kind of didn't have to deal with that part of me that was really devastated, that I left this profession that I loved so much. I loved it more than treating clients, more than, I loved supervision too. So supervision was my second favorite. That was teaching was my absolute love. I couldn't love it more. And the devastation and toll that it took on me didn't hit until I was not with FAIR anymore. And I was on a completely different trajectory. I did start getting more involved with CTA, and that brought some grounding to me. But I have to say that before I got to that place, I was really angry. And I felt very angry and resentful because I thought, you people, this ideology has taken away something from me that is so beautiful and so meaningful, that is my total sense of identity. I was totally wrapped around that identity-wise. And I felt as though somebody was taking it away and that I didn't have a say in the matter. I didn't feel empowered. All those things that people kind of said to me that were so kind and warming and touched my soul, deep down, I didn't really feel that way. I felt disempowered, that something was being taken from me that I could never get back, because once it was out there, I can't teach again in this profession unless I was to teach at a school that had completely different philosophy on all of it. And we're not there yet as a society in the field. So for me, there was a delayed process before I really started grieving. And then I was grieving losing relationships with some of my colleagues who were wrapped up in this stuff, and we weren't able to there were some impasses. COVID's going on, and I'm not good with the masks either. I ended up going to a couple stores without a mask and got into arguments with people about, you need to put on your mask. No, I don't. This is, you're taking away my rights. And I think there was so much happening. The forced vaccinations were coming along in mandates. So there was so much going on that I felt that in so many areas I was being pulled apart, and what did I have the energy to sort of fight for or fight to protect? And what was just too much, where I just needed to say fine and let it go. And, surprisingly, I did make it through the mandates without getting vaccinated. I did make it through, the mask kind of chaos, and I stopped giving business to places that required masks. I started doing things like that. And I did survive leaving teaching. But and I don't have the same level of anger today that I had before. But I don't know and I'm wondering if that's something that you can relate to, because, you were talking about, you had left law school, you were deciding now that this was your path. You'd rearranged your life, it sounds like, to make it happen so that you could go back to school and be in this program. You're there 2 quarters and you're seeing this whole thing just sort of, the walls are kind of collapsing all around this for you. So, I mean, when you came out and made that video, and maybe directly after that, did you feel a sense of loss? I mean, was there this feeling that you had given up so much of your life or so much of something to do this, and now that isn't something you're going to be able to continue? Or was it more of an empowering thing to kind of expose and to move down that road?
Yeah, there was a sense of loss. So at the point where I was in that program for 2 quarters, and I was starting to have that my God, like I've done so much to be here. Do I have to give this up and go back to the drawing board, or do I keep going? I kept going, and I just kept on putting one foot in front of the other, taking one more semester, one more quarter. And I was almost done with all of the coursework that I had at the point where I finally put out that video. That was a couple of years later. So we're talking about 2019 all the way to 2022. And it was it was always like, I guess I was at that crossroads that whole time. And I kept on plugging away because it was really important to me to finish the program and finish what I'd started. But I was really aware of walking a tightrope, trying not to compromise my principles and my values in the process of doing it, and being very much on that tightrope as I did that, because of the things that I was required to talk about and the way that I was being required to talk about them. So I was always doing sort of linguistic gymnastics to try to stay in line with my own values. I think the loss and the emotional confusion for me, a big part of that in the early part of the program was that I had grown up in a place where I was in the ethnic minority. I was a white kid in San Antonio in this poor side of town where most of the kids were Hispanic. And I got bullied quite a bit for being white. I mean, it was just a thing that made me different. I wasn't the only white kid, but there weren't very many. And it was a thing that was a stain on me, that made me uncool, that made me sort of untouchable. It was there's no two ways around it. The teachers liked you less and the kids liked you less, and you were left out. You were in the uncool category, and it was open season to make fun of you for being white. And this was hard. Like any experience of childhood ostracism is hard for kids. And I had done a lot of work on my own over the years to come to terms with that. Like any kid that is bullied when they're little is going to have to integrate that experience in some way in order to not carry that forward with them. And the way that I had learned to understand that was just through sort of a social psychological lens, in-group and out-group dynamics, that this is something that's present, and it's not some great evil. It's just a human behavioral dynamic that presents itself in lots of places and times. And if you're in the minority, you have this particular vulnerability, especially when you're in a place that has other economic or social pressures that make hostilities a little bit more readily available right at the surface, like where I grew up. And so to go through all of that and be pretty healthy in terms of racial identity and recognizing the multicultural, multi-ethnic society that we're in, and feeling finally pretty good about myself and not hating that I was white. To go back into a program in your 40s and be told, no, you actually are a terrible person because you're white, and you're supposed to feel really bad about that. And you need to stand up here and fess up your privilege and tell the class how you have been unwittingly perpetrating white supremacy all of your life since you were a little kid against people of color, and tell us how you feel bad about that. And you have to give these confessionals, and you were really asked to do this in our forum posts that we would do in these hybrid classes and on the online classes. You are supposed to be confessing your privilege and talking about how you as a white person have been hurting people of color. There's no room for you to be able to say, actually, I'm a white person who was bullied by people of color when I was a kid. And I don't feel guilty like I've been out there like hurting. I don't have white guilt. Sorry. And it's not because I'm some special victim. It's because these are facets of human behavior that we should be able to talk about on a more elevated level, because for God's sakes, we're studying graduate level psychology, and we shouldn't act like this is whiteness. This is peopleness, you know? So the loss, I guess, that I think it was very, I felt like I was being gaslit. And I know that word has been really trendy over the past 10 years or so, but I think it's trendy for a reason, because it's a feeling that people can really relate to. Like, I am looking at that thing and you're telling me it's not there. Or or I see nothing, but you're telling me I'm supposed to see something. It's the emperor's new clothes. And it's a really confusing and disorienting experience. That was the real loss that I experienced, I suppose, was just going through this, realizing that I was going to have to acquiesce to having people mess with my sense of reality in order to walk towards this goal. And
Yes.
I pivoted fairly early in the program. So I was working in a naturopathic clinic, and I decided I would go ahead and get a health coaching certification. So I studied that. I thought, if I can't do counseling, I still want to help people and I have a very holistic view of human wellness. I really see our body and our mind as being, you know, inseparable. This is all one and the same. We are a holistic entity. And so early on I thought, you know what, if I can't use this degree in order to become a licensed counselor because I'm not able to acquiesce to all the things that I would have to do to be licensed, I'll work as a health coach. I'll work as a holistic kind of wellness coach, and I'll acquire better skills at talking with people through this program. If nothing else, I will get better at patient care or client care, whatever we're going to call it. And it'll still be a net benefit to me to take some of the skills classes that I'm going to get through this program, even if I can't use those. And as I went through the program, I thought, you know what, I can't see myself pursuing licensure because of the accrediting bodies being filled with more of this stuff. And I don't see myself wanting to be licensed in the state of Washington where I live, because some of the restrictions on so-called conversion therapy, where they don't even let you have gender exploratory conversations with clients here. But I like the coaching idea just fine, and I can still do that. So it was something I pivoted to kind of early on, and that helped a lot. So that was, I guess, what you described with your situation, where you're deep into this career that you've really worked hard to be. You've already established it, and you have this position in which you are a full-time professor without having to complete your doctorate, which is really cool. That's really quite an honor. And it says a lot about the value of your teaching to the institution where you were working. And it's a really wonderful capstone for a career. Like, you've gotten to this point, you could probably do that. I mean, you're in your 40s. You could have done that for another 20, 30 years, and you had a really rich career for a long time. To have to face letting that go, I think that sounds really difficult. And it was difficult for me, but I was at a point where I found some flexibility and was able to salvage a really meaningful career that, while it doesn't involve mental health diagnosis and treatment, it still involves interacting one-on-one and in with families and couples to help people make changes and improve their personal circumstances.
Yeah. I mean, you're absolutely incredible at what you do. And I think that comes across in just the way that you connect with people, all these interviews that you've done, how you've built your YouTube channel, how you've built a following. I mean, a rather large following at this point.
Oh, thanks, Christine. That's nice of you.
I think that's true. You're very gifted. And I think it's a great loss for the mental health field to not have you be a part of it, but it's such a gain and so necessary and needed for you to be in the position you are as a coaching. And I know that's only one thing that you do. You do all of these other podcast interviews. You're involved in a lot of other projects. I know you're involved with OTI now. And so I guess kind of the next step, I mean, what are next steps for you? I mean, at this point, you were able to develop your coaching career, and you're able to, have your hands in a lot of things. So what is next for you? Where do you see yourself kind of moving from this point forward? And how different does that look than what you were expecting it to be when you first left?
Oh gosh. Yeah, that's a good question. So I have been doing work with Open Therapy Institute. I really appreciate the work that Andrew is doing there, and the people of OTI, that they're really building something that's incredibly valuable. And just like CTA, these are amazing resources for people who are in the field, who are licensed mental health workers, or students who are seeking that career path and need some social support or some alternative training opportunities that aren't completely, I guess, biased towards the critical social justice mindset. I really believe in these organizations and I want to do what I can to support and help that work. I also have one of the reasons why it was possible for me to pivot to coaching instead of really continuing to mourn and bemoan the loss of this particular educational path. I don't feel any bitterness about it, actually. I don't even uh I prefer what I'm doing. I prefer the flexibility of what I'm doing over that licensed mental health practitioner path.
Yeah.
There are things that I lost when I gave that up. I lost the ability to bill insurance, which I would not have done anyway, because I have strong feelings about the loss of privacy that patients undergo when they start using their health insurance to work with mental health practitioners.
Totally.
And I feel like it would be, and this is probably going to be controversial. Some people will agree and some people won't, because people have different feelings about this in terms of access to care, et cetera. But I feel like for me, it would have been unethical to practice as a therapist and bill insurance for that. So that was already not a possibility for me when I headed out. So that's one thing I would have lost. I did lose professional standing and status, because I don't have the same credentials. I don't get the same respect. I don't have all of the same qualifications and trainings that people want to see in their colleagues. So that is a loss. And I lost some of the networking opportunities that I might have had. But honestly, I'm okay with those losses, because the work that I wanted to do, I can still do.
Yeah.
It's just, it takes on a different form. I'm still working in a supportive capacity with people. And what is next? I don't know. This is something I've been chewing on for a long time, and I'm not sure I'm the person to do it, but it is something I'd like to be involved in. I'd love to see an alternative practice form take root and thrive. I would love to see a philosophical counseling organization sprout up to sort of fill in some of the gaps that are left behind when counseling as we know it right now has become so medicalized. It's really driving things into this biomedical model that I think doesn't serve a lot of people very well. And it's also that as an institution and the institutional life cycle, you see this happen. We're at this point in a lot of our medical and educational and academic institutions when they have lost their original purpose, and they are more about self-sustaining, and they've been cannibalized by this social justice thing, which is really antithetical to the principles on which they were originally founded. So you see as organisms, as bodies, these institutions are in a very sick place, I think. And so I think that there's room for a new branch of the helping professions that leaves aside some of the things that aren't working, goes back to some of those original principles, and I would love to be a part of doing something like that. So I can imagine room for something that's more like what we call coaching, but is a supportive, non-authoritative form of personal consultation and care.
Yeah, and you're just the person to champion that and to lead the charge.
I don't know if I have the energy for it.
I know.
What about you, Christine? What's next for you?
Well, that's such a good question. So I became very involved with Critical Therapy Antidote as well. I wrote an article for them in 2021 when I found them as well. And that turned into a book that Val put together. There's, I think, 18 of us who wrote a chapter for the book. And that book is called Cynical Therapies: Perspectives on the Anti-Therapeutic Nature of Critical Social Justice. And that was very enjoyable for me. I got a chance to kind of tell my story about being a professor and how things changed from when I went to school at the same place and then how it was when I started teaching. So that was very therapeutic for me. And now I'm more involved with our members' arm division of a CTA. So, developing content, developing our membership base. And we have a lot of exciting things coming up. We're trying to focus a little bit more these days on a training arm. So what we want to provide is courses for, therapists or people who are even still in school that maybe aren't getting some of these basic skills that are supposed to be being taught in counseling and therapy, courses and programs, but aren't being taught, which, is just a travesty. So we're wanting to start creating some trainings for people who maybe want to get some of those skills, learn some of those skills, deepen some of those skills, and sort of springboard from there, and eventually kind of have a couple of maybe a 3-tiered or so training program that people would be able to come and take courses and get what they can't get in traditional schools. I mean, ideally, I think we'd love to be a training institute, and that would be amazing to see. But that would take some time. So at this point, we're just starting with developing some of these courses, continuing to develop our membership and content. So it's been, very rewarding to do that. And I think what it's given me more than anything is hope and a sense that I think that we're going to get to the other side of this and we're going to be okay. And there was one point where I did not see any way possible for us to be okay, that was never going to happen, that we were doomed for the next 5+ decades, if not more. But I can see now, and I think my work there has helped with this, that we will get through this and there will be something different that will be birthed and that will be developed. And I think it will be better. And I think it will serve more people, and it will serve the people that don't maybe fit into the medical model. I think that we have limitless opportunities to do that. And so I guess that's what's next for me. It's kind of how my perspective, I guess, has changed, but it's definitely taken a few years. I mean, I guess it's been like 5 years now for me. So it's taken some time to get to that place, but I can actually see that. So I think there's a lot of hope. And I remember when we first met, just that it was lamenting on how dead end it felt and how no light at the end of that tunnel was even plausible. So I think it's a good thing to see that, more people are speaking up, more people are exposing, more people are coming forward and saying this isn't okay. More people are coming forward saying we've got to do something else and something different. So that's exciting.
Yeah, it certainly seems like in the last couple of years, it's become easier for people to have these kinds of conversations. The kind of conversations that people were calling brave 2 years ago are now, I mean, maybe there's still some risk involved, but not nearly as much, because there's so many really intelligent and thoughtful people who have already been engaging with these ideas and just kind of calling these ideas out, not in a pendulum swing kind of way, like throw everything away, but like point out the excesses of some of these teachings and how they could be reined back in to make more sense for people.
Yes, absolutely. That, I think, the fact that people have been more open to having these conversations, I mean, it's helped me be more open in my life with people that I love, with people that I meet for the first time. I'm a lot more vocal about that, without feeling, as you were saying, a sense of risk. I think that that's died down significantly, but I'm very proud of the work that when I say we, I mean you and I, in this context, that we did when it wasn't safe necessarily to do that career-wise, and we did it anyway. So I think that, that's one of the things that's bonded us, I think, and what I respect and value so much about you. And it's not all of what I value about you, but it's definitely the piece that I learned about first, and was very honored to do that. So I really want to thank you, Leslie, so much, not just for this interview today, our conversation, I should say, but just for all the work that you do and for how much you've involved me in the work that you do. And I, want to just thank you for just being you and
Christine, that's so nice.
I mean it, just unapologetically yourself. And that's really hard to find. So
Thank you.
Before I get emotional, I guess.
Well, that's,
I'll stop talking.
You've been one of my favorite people to work with, and that's why we've ended up collaborating so much. You've been you've come on the last you started doing Solid Ground live streams with us last year in the fall, I guess, and now you're a regular contributor there, and you've also been hosting a group for us each week with our support group, our peer support group, and your collaboration and your input to these things, you bring so much heart and also so much wisdom. And I am so glad I met you at the beginning of this journey. You've been a huge support to me in this process. And
you too.
I value your friendship and your collaboration. Thank you so much.
Yes, thank you. And thank you to our listeners for being right there with us throughout all of this. And we're glad to just continue forward and march on.
Absolutely.
All right.
Yeah. Thanks, Christine. Right.